I tend to see quite a few anxious patients. These anxious patients can range from pediatric patients, and they can also be adult patients. And when anxious patients come in, I handle them a little differently than a typical patient. And the reason being is because they're already coming in with their own sense of anxiety and fears, and they have preconceived notions on what to expect for their visit. And so I have to kind of comb through that and figure out the best way to earn their trust, to make them feel comfortable, and help keep them calm. So for pediatric patients, sometimes that means a fun game or finding a common interest between us. So I do have 5 children, so with pediatric patients, I find that quite easy to gain their trust easily, just because I know a lot of things that my own children like. So I'll find a game or maybe music that they like, or even something in the dental office, like say like my water syringe. Sometimes I'll call it a sprinkler, and then we'll talk about how that's like a little sprinkler that they would go in outside or at a water park. So that's where I gain trust, and I can infiltrate their fears that way. For older patients or adult patients, it's kind of the same thing. I find a common ground where we share an interest, or I can tell them a story. So for example, I had a patient today, an older gentleman who's getting a large amount of extractions done, very, very nervous. And I sat with him and I was telling him my story about my own extraction experience and how I thought it was going to be a lot worse than what it was. And actually, when he finished his procedure, that's exactly what he said to me. I was expecting it to be a lot worse than what it was. I also held his hand. We did a lot of rubbing of the arms and trying to just, distract him so that he felt a little bit more comfortable. But as soon as he's leaving, he's saying the same things that I've said about my own experience in the dental office. So that's what we want for our patients, is to calm that anxiety, calm those fears by finding some common ground and gaining trust early on in the relationship, so that patients enjoy coming here, they know what to expect, and the anxiety levels significantly go down.